So thank you everyone for being here. I know it is really super early in the morning, so I do appreciate it. My name is Polly Livermore. I'm a paediatric rheumatology nurse at Great Ormond Street Children's Hospital in London in the UK. And I've been asked to talk about the mental health impact of JIA. This is a specialist area of interest of mine. It's also close to my own heart, and I've been doing some research in this area. So to begin with, just to start with my disclaimers, what I'm presenting on today is not my own research. I'm actually presenting on behalf of a charity collaboration, which I will explain more about as I go through. I'm also funded by the National Institute of Health Research on a fellowship. But most importantly, what I'm going to present today is quite sensitive work. I'm going to be sharing with you some voices and words from children and young people themselves. We all need to look after our own mental health, so if anybody in the room at any point feels like they need to leave, please, especially people in the physical room, please do feel free to get up and leave. And obviously, if you're at home watching this virtually, then please just turn me off. That's fine. Okay, so I'm going to be covering these few things today. And you might be wondering why I've started with a slide about JIA. So we're at a paediatric rheumatology conference. In fact, we're actually the last day of the paediatric rheumatology conference, so you all get a special badge for being here today. But as clinicians, as physicians, as health professionals, we focus on the physical side of things. We focus on the biology. We've heard quite a lot over the last couple of days about biomarkers, about investigations, about different treatments. So why do we do that? Well, predominantly we're paediatric rheumatology type people, so we have patients that come to us with a paediatric rheumatology complaint. And so our focus is on how we can help children and young people to get their disease in the best state it possibly could be in and to get that well controlled. But actually, we often neglect and forget about the mental and the emotional and the psychological side of things, which is equally just as important. And if that is not looked after, then it's much harder for children and young people to cope with the physical side of things. So we all have mental health. We all have good days. We all have bad days. For me personally, it's day 6 of being here. My mental health is slightly struggling right now. But how is that impacted when you have a chronic health condition as a child or young person? So on this slide, there's some things that we've been discussing over the last couple of days, and I'm just going to whiz around them. So obviously, we've got the limitations that the disease in itself can cause. And how does that impact upon daily activities of living for children and young people, brushing their teeth, combing their hair, getting dressed, all of those things? We've got the treatments and particularly about hospital appointments and about going in and having therapies in hospital and the impact that that has. Living with chronic pain, daily pain, whatever pain, just living with pain is really, really hard. The implications from being different to our peers and how children and young people interpret that and what it means to them. We've heard quite a lot about fatigue. So fatigue is really hugely important for children, for young people, for their families. Body image, how we see ourselves, how we are coping day to day with those ups and downs that I've already mentioned. Our school, our attainment, our educational going to school and physically being there, but then actually our abilities when we're at school and how much we keep up with our peers. Worrying about the future, our uncertainties about what might happen tomorrow, what might happen next week, what might happen in a year, what might happen in 5 years, 10 years. We've heard about how society views arthritis. We've heard that there was a great poster I saw, did a poster tour of yesterday about people without arthritis, about how they view arthritis and whether they know children and young people get it. We know about the implications from having uveitis and how that affects children and young people in their day-to-day lives. And what about the side effects from the medications? As a paediatric nurse, I spend a lot of my time talking to children and young people about how they feel about their therapies. We've got the invisibility of the disease, and I've done some work with children and young people. Children and young people want their disease to be seen so that people can treat them as if they have a chronic health condition, but equally they want their disease to be invisible so they merge in and fit in with their peers. We've got about independence. We've heard about transition. We had a great talk from Dr. Janet McDonough about children and young people and moving up and taking over some of those roles as they go through into adolescence and then into adulthood. And then obviously, importantly, most importantly, is the family and how that child or young person fits into their family, how their family help them with their emotional and their mental health well-being, and obviously the impact on the parents and particularly the siblings, which often we neglect. So I did say I was going to share some words from children and young people. So these are some words from a young person that we collected in our survey, which I'm going to talk about in a second. So she said, JIA goes way beyond physical pain. It impacts my life, my mental health, and how I see myself in the years to come. I'm very on and off with medication. I find it hard to be consistent, and I'm fearful of the side effects that come with prescribed medication. I've been in so much pain that I've tried to end my life. Okay, so this is a charity collaboration, as I've said, and this collaboration was established due to a shared need to do more, to raise the profile, the importance of mental health support in paediatric rheumatology. This is a UK charity collaboration with the people that you can see here on the slide, and there's also some bigger group of people in the background. And the aim was to work together to evidence the need and to campaign for timely access to developmentally appropriate mental health services for paediatric rheumatology. And you can see the charities listed here. So just to give you a bit of background about the scale of the problem. So in 2017, so we're talking 6 years ago, on average, these are UK data, just to highlight, that nearly 12% of 6 to 16-year-olds had a probable mental health condition. And these numbers are prior to COVID. In 2019, this had risen to 17%. And since COVID, we obviously know that mental health has been hugely impacted for children and young people, but 60% more of those children and young people in 2017 have a probable mental health compared to previously. And we know a lot of those are not getting the help that they need and they require, and what can we do about it? We know that 50% of all mental health problems start before the age of 14 and 75% of those before the age of 24. So these are huge reasons why we need to be doing more. And what about when you have a chronic health condition? So at the age of 15, if you have a chronic health condition, you're 60% more likely to be diagnosed with a mental health disorder than your healthy peers. And in July 2021, the highest ever number of children and young people in the UK came in contact with mental health services. When we think about recommendations, what we've got to help direct paediatric rheumatologists and health professionals, in the UK, the thing we refer frequently back to is the UK standards of care, but this is 2010. But even then they were saying that a paediatric clinical psychologist should be part of every paediatric rheumatology team. And we know that there's huge equity across Europe. I'm obviously standing here in Rotterdam today. You all have different centres with different teams and your compositions and how they're made up. There is huge inequity. And in the UK, when we asked people if they had access to psychology, 68% said they did. But actually, when you drill that down, it was less than 4 hours per week. So what did we do? We did an online survey, as you can see here. It was delivered via charity mailing lists and social media. Parents could complete it, children and young people could complete it, or they could complete together. They had to consent to move through the survey, and we collected a little bit of demographics. So just to highlight, be upfront, I'm a researcher, so I think it's really important to spot some of our limitations before you lot spot them. And one of those is the bias of those who might have responded. So obviously, if you are a child or a young person in a family, you're more having conversations about mental health, or you're having more mental health concerns or implications, you might do this survey than a family who might not. It's also, obviously, these were sent out via charity lists, so it was from families that were aware of the charities or were part of them. We did exclude young people over 18, which is a huge limitation, obviously. Childhood doesn't stop at 18, and so that's work in progress for the future. We were only looking at JIA. We needed to cut the survey off somewhere, and again, that's work for the future. Obviously, it was a survey in English, so that automatically excluded some families. The age range of some of the patients meant some of the questions were inappropriate. Some of the parents put that obviously if they had a toddler, some of the things we were asking about, they hadn't noticed, but it's quite hard to understand what a toddler feels to some of these things. Also, if they were newly diagnosed, some of these things weren't a problem yet. So we were asking about the impact of paediatric rheumatology conditions on their mental health and emotional well-being. But if they were literally diagnosed in the last couple of weeks, things like having side effects from medications potentially hadn't started. And not all questions captured all possible answers, and I'll highlight one of those as we go through. And we didn't capture any clinical data, so this was all kind of self-report from families. So we had 291 responders. The majority of those were a parent or a carer, as you can see here, 79%, so 229 of those. We had some young people completing it and some parent and child completing it together, as we'd call a dyad. When we drill down and look at the age of the young person completing it, you can see there the majority were 15 upwards. And when we were looking at region of the UK, we had quite a nice good spread. We had more patients completing from Scotland. And when we were asking them about how long they'd been diagnosed, the majority, 35%, had been diagnosed longer than 6 years ago. In the UK, JIA care is structured slightly differently, depending on where you live and what you have access to. So we asked our respondents what type of care they have, and 45% of those had shared care. So that means they would be under a local hospital, but they also might be under a specialist hospital. So in theory, that doubles their chance of coming into contact with psychology. So our top 5 findings, I'm going to go through each of these in turn, but we found the impact of a paediatric rheumatology condition on the child or young person's mental health, on the family. We found that there was a real need, as we had anticipated, for timely intervention, thinking about awareness of and access to support for families. And what does good look like? This was a charity survey. We did have some amazing responses from some great families out there, so I'll share some of those. So finding 1, looking at the young person themselves. And we asked, what's the current situation of you or your child or young person regarding mental health support? And while 41% had not needed mental health support, we can see that the other 60% have either had it, are currently having it, or are waiting for it. We asked them about school and we asked them about their emotions. 73% of children and young people have difficulties in school because of the JIA in our survey of the data we collected. And 63% of those said that they felt isolated or lonely due to their JIA. So another quote from a family. The anxiety around her injection is getting worse. Even when getting ready in the morning, she's getting so anxious and crying, not my injection, not my injection, at a loss of how best to help and support her. So when we think about the wider family, these are families that are living with these conditions every single day. They can't escape from it. As one of our charity workers said very clearly, it's like an unwelcome guest in your house. It is just there and you can't get rid of it. And it even follows you on holiday. It is constantly there. I needed support earlier to understand how my role as a parent has changed, how to resolve hurting my child with injections or physiotherapy was necessary versus giving my child trust issues. A parent is supposed to protect their child, and here I was causing pain. I hate that part. And for me as a paediatric nurse, this is really important because we ask an awful lot of our families, we really do. And as a parent myself of 3 adolescent boys, I couldn't imagine what it would be like to have a completely different role like this, in the sense that you're not just a parent anymore. You are a pharmacist, you're a physiotherapist, you are a teacher, you are a taxi driver, you are their advocate. You take on so many different hats. But obviously, encouraging your child, making them do physiotherapy, and seeing them in pain, and then giving them injections. We've got parents who crawl under beds to give methotrexate injections to children and young people at home. If you are a parent or a carer, do you feel your family's mental health has been impacted by your child or young person's JIA diagnosis? 82% of our respondents said yes, with only 7% saying no. When we asked about siblings, we got a 47% yes. However, my fault, we asked, are siblings affected, yes or no? We didn't say what happens if you haven't got any siblings. So take that result with a slight pinch of salt. A parent said to us when we asked about their own mental health, it has never been discussed, but has caused a marital breakdown and severe jealousy by a sibling, so has turned our lives upside down. If you feel that your child, young person's JIA diagnosis has impacted upon your own mental health, have you been able to access relevant and suitable mental health support? So 46% of those said they hadn't tried to access support, and 27% of those said no. So why, as parents, those 46% have not tried to access support? Is it because it's not there? Is it because it's not their health condition and actually it's their child's health condition? Is it because nobody's ever offered it? Finding 3, the need for timely intervention to prevent escalation. 81% of our respondents said they had issues with needles. A lot of our rheumatology care is given by needles because we're really kind like that. 78% of children and young people have suffered from medication side effects. To me, I think that's quite low, actually. I'm surprised by that. I would expect it to be close to the 100% mark. Maybe these are some of those patients that are newly diagnosed, or maybe there are younger patients who don't necessarily report them. Where did your child receive mental health support from is different to their rheumatology care. And you can see there that school was quite a big one. For those of you outside the UK, we have a service in the UK called CAMS, which stands for Childhood and Adolescent Mental Health Services. So this is not health condition specific. This is just if you went to your GP and said my child is struggling with anxiety or depression, you would potentially get referred to CAMS and then sit on a waiting list for 2 years before you're seen. So CAMS did come out, but also school was quite a big thing, privately or still waiting. The waiting lists are too big. My daughter has developed several mental health issues resulting in an overdose, so now getting support outside of JIA treatment, but more support would have been better earlier. And this is one of the things we have discussed at length is whose responsibility is it for some of these issues? The rheumatologist is very busy doing rheumatology type things. As I said in the beginning, they've got a patient in front of them that they've got to examine their joints and they've got to prescribe some kind of magic therapy to make them better. They haven't got the time necessarily to delve into some of these issues. So finding 4, awareness of and access to support. Our child's mental health suffered from the onset of symptoms to present day, with ongoing anxiety around school and attendance, friendships, loneliness. I believe mental health should be just as important as physical health. And so do I. Does your hospital team have access to mental health support services for you or your child if you need them? 53% were unaware if their hospital where they were being seen had mental health support services. And finding 4, what does good look like? As I've said, we had some fabulous comments. I'm just going to read a couple of these and other sources of support that families highlighted to us. We had a brilliant lead nurse, went through this, made such a difference, always in contact. Fantastic team within our area. If it needed, they were okay to get in touch, would get back with replies. We are lucky that our rheumatology team has a psychologist who over the years at different times has been a godsend in order to help our daughter. My son was offered art therapy sessions after I asked for support, as he seemed to be struggling mentally 6 months after diagnosis. Art therapy is a fabulous thing in the UK. It's been cut and squeezed, as most things have, but often they would be sat in clinics in the waiting room and spending time with families. And the charity. So obviously all of our charities involved. Our charity is fantastic. It works closely with hospital consultants and nurses, and events held really help children realise when they are not alone. And we're very, very, very lucky in the UK. I know that. We have some fabulous charities who do some great work, and without them we would be in a lot worse position than I'm standing here today talking to you about that. But obviously, as I've said, it's very different across not even the UK, but also across the world. So now what? What do we do next? Well, this work is moving forward. This is a charity collaboration. It was just the start, this survey. So as I've said, we're looking at the other health conditions, obviously. Paediatric rheumatology is not just JIA. We're considering need to do a lot of work about mental health into transition, especially as these children and young people are going on into university and adulthood. Timely access is so important. We need to do more research to find out if we intervene at a really early stage, do we stop some of these things escalating and the situation we're in now. And working better with mental health charities as well. There are some fabulous mental health charities. So how can we access and raise their awareness to our families? So children and families come into clinic, and I often share this story. I had a physician who said to me, I never ask the child or young person. They come in, they don't want to be there, they're on their phones, they're staring at the floor, they just want to leave the room. I don't talk to them, I talk to the parent. And actually, after I'd finished a similar talk, he came up to me afterwards and said, from now on, I'm going to ask the child or young person how they're really feeling. And often you get this answer, and we all give this answer, don't we? But actually, we need to delve deeper. We need to really find out what is going on and how we can support people better. So what can be done? My recommendations to you, and I haven't got any magic solutions, is to really ask and then to really listen. Emphasise that support is out there and refer families on as quickly as we can for further help. Thank you.